Past President, dear colleagues, ladies and gentlemen, I would like to start by saying that I am very pleased to see the record turnout of the meeting, the increasing participation of the Spanish and Portuguese speaking America, as well as the high quality of the program. As you all know, the most challenging task of this position is to deliver the presidential address. I would like to start my presentation by saying how I got here, what would the new phase be, what is the potential of the new phase, and then some closing remarks. This is the National Institute of Nutrition, a leading institution for internal medicine and surgery in Mexico. As in many other institutions, surgeons at the foundation perform truly general surgery, and in many instances, out of the scope of general surgery. During my residency, Dr. Letaif, Chavez-Peon, Cárdenas, and Campuzano started to differentiate in the various components of endocrine surgery. Dr. Orozco felt the need to have subspecialists and started sending people abroad to expand their knowledge. This has been maintained by my current chairman, Dr. Miguel Mercado, and I feel very happy by having him with us today. And this is how I had the opportunity of spending some time at the Mayo Clinic with two incredible mentors, Dr. John Van Heerden and Dr. Clive Brandt. To go abroad for training always implies some lessons to be learned. Lesson number one is that winter may be different in different places, such as Veracruz, the city where I went to the medical school, and Rochester, Minnesota. Lesson two is that primary hyperparathyroidism not only presents as an sporadic or a familial disease, but that it may be epidemic, and you may face 6 cases scheduled by one surgeon in one day, besides the usual stuff such as a couple of thyroids, 1 or 2 adrenals, and a pancreas. Lesson 3, and most importantly, you learn the real meaning of mentorship. And I feel particularly honored by having my 2 mentors at this meeting today. A nature implication of being devoted to endocrine surgery is that you become aware and may be part of a true professional family, the AAES, which works tirelessly to achieve the highest standards in all its edges and represents the whole Americas. Different from most families, where you have only a few number of brothers and sisters, and rarely they are at your age, in this family, you can learn from the fathers of endocrine surgery, from your older and younger brothers and sisters. I have had the opportunity of learning from many of you, but there is a particular group of people with whom I have interacted from the first meeting I attended in San Jose, California, and which I call my class. My home institution, my stay at the Mayo Clinic, my mentors, and your teaching is what brought me up here. All things in life evolve, and medicine is not the exception. If we focus on genetics, we can see a steady evolution from the Mendelian genetics to advanced high-output genomics. Surgery has evolved from the description of anatomy and the incorporation of asepsia to the robotic era. And endocrinology has evolved from the brown secret elixir to modern endocrinology. This evolution at some point was represented by traditional endocrinology, which mainly covered the hypothalamus and pituitary axis, the parathyroids, and the adrenals. Whereas modern endocrinology includes the enteropancreatic system and some other important areas. In endocrine surgery, after a primary and a strong interest in the thyroid and the parathyroids, there was a slowly increase in the interest in the adrenals, the pancreas, and lately in the neuroendocrine tumors. However, despite the fact that the gastrointestinal tract produces and secretes a myriad of hormones, these hormones have attracted only a handful members of our organization. Most hormones produced in the gastrointestinal tract have actions on the hunger-satiety complex. The function, triggers, and mechanisms of action have been extensively studied. To give some examples, we know now that ghrelin is an orexigenic hormone mainly produced in the stomach, which stimulates appetite, acting on the arcuate nucleus of the hypothalamus. We also know that PYY is produced in the lower gastrointestinal tract and has an opposite function to ghrelin. Intensive research has permitted to understand the role of this and many other hormones. The field where knowledge of gastrointestinal hormones has been mainly applied is obesity surgery. As you know, several surgical procedures have been used to induce weight loss, and the understanding of the gastrointestinal physiology, and in particular, the role of gastrointestinal hormones, has been of paramount importance to better comprehend the role of each operation. In old days, the mechanisms implied in most operations were mechanic. We used to think that if the normal size of the stomach permitted the development of obesity, to make it smaller should serve for its treatment. That if the normal length of the bowel permitted the development of obesity, to make it shorter should aid in its treatment. And that if the size of the gastric outlet was not sufficient to prevent obesity, to make it narrower should help. Obvious. However, the understanding of the different pathways to reduce hunger, to promote satiety, and to reduce absorption of nutrients changed the mechanical theory to a hormonal concept. Since the discovery of ghrelin in 2002, it was noticed that its secretion reduced after operations involving resection or exclusion of the gastric fundus, with a direct impact on hunger reduction. It has been also noticed that in operations where food reaches the distal bowel sooner, there is a rapid increase in PYY with the consequent appearance of satiety. Physiology of operations such as the gastric bypass give us the opportunity to learn the pathways explaining the mechanism of action of bariatric surgery. And as you may see on this slide, they now look very different to the mechanical theory. They also emphasize a strong hormonal component. Almost as important as weight reduction, bariatric surgery has demonstrated a strong impact on diabetes control. Among the known mechanisms to achieve diabetes control after bariatric surgery, one is food restriction, other is weight loss, but hormonal changes undoubtedly play a major role in diabetes remission. There are two hormones, GIP and GLP-1, named categorically incretins, which play a major role in the glucose metabolism. It has been demonstrated that the performance of peptides such as GLP-1 would explain, at least in part, the rapid normalization of glucose levels after procedures where the proximal bowel is bypassed, and that they have actions not only in the gastrointestinal tract, but even in the brain. And it has been shown that diabetes remission is achieved not only by improving insulin sensitivity, but also by improving insulin secretion. Therefore, operations such as the gastric bypass promote diabetes control before significant weight loss occurs through various acute mechanisms which persist in the long term. And here is a summary of sources and actions of gastrointestinal hormones and also how they behave after surgical procedures such as the gastric bypass. There is only a few number of endocrine surgeons who practice exclusively endocrine surgery. Some combine it with general surgery, some others with surgical oncology, some more with laparoscopic surgery. There are surgeons who also take care of diseases of the breast and even the ovary. And perhaps there is time to think in incorporating what it's called now metabolic surgery. There are already some academic institutions, such as Mayo Clinic, the New York Mount Sinai, and my own institution in America, where surgeons combine endocrine with metabolic surgery. And there are also some institutions in Europe, such as the Hospital AAES in Lille, France, the home of our friend, Dr. Charles Proy, who have a similar profile, and there may be others that I don't know. Most importantly is the significant impact that these institutions have had on the knowledge of metabolic surgery. A few examples are the intense research work that the Mayo Clinic has had in their characterization, diagnosis, and treatment of hypoglycemia after bariatric surgery, or the methodology to assess beta cell performance at Mount Sinai, or the proof that metabolic surgery has a significant impact on NASH demonstrated at the AAES Hospital. Or the characterization of the gene profile of obesity in different Mexican populations performed by Dr. Velasquez at our institution. Bariatric surgery is still looking for a better name. And this may very well be endocrine surgery. I don't know how much enthusiasm endocrine surgeons are going to have in incorporating bariatric surgery in their practice, but I hope you may at least consider it as a potential phase for endocrine surgery. And a new phase should come with a new tie and scarf. Traditionally, the thyroid and the parathyroids have represented our specialty, and I think it is time to incorporate more elements from the spectrum of endocrine surgery. And here is the 2013 AAES Tie and Scarf. These ties and scarves were developed by Pineda Covalin. They are Mexican artists that create accessories adopting Mexican motifs to design unique patterns. In the 2013 tie and scarf, of course, the thyroid and the parathyroids are well represented. But there is also the adrenal from an outside view, and also showing the difference between the cortex and the medulla. And there is the pancreas. You may have seen that some of the pancreas were included along with the duodenum, and I foresee that these may have different interpretations. Traditional surgeons may agree that this is appropriate, since most gastrinomas localize in the duodenal wall. But perhaps more revolutionary surgeons may accept this as a reminder that there is more than gastric in the gastrointestinal tract. To give a Mexican touch, the crook of the Mexican Aztec god Patecatl was also included in the tie and the scarf. Patecatl was a very important god in our culture, and this was because of two things. One is because it was considered the god of medicine, but also because it's attributed to him the discovery of a product, a medical product, that has persisted through the time around the world, the Physiology. Ladies and gentlemen, it has been an enormous privilege to serve as your president this year. Thank you very much.